The next procedure on our ladder is another restrictive procedure known as the vertical sleeve gastrectomy. It is a procedure that's been part of the duodenal switch procedure for many years, but recently has gained popularity as being a procedure on its own. It is, once again, uses restrictive principles and therefore is limited in terms of its effectiveness. In the vertical sleeve gastrectomy, 85% of the stomach is removed, creating a shape much like a banana. The muscle in the stomach, called the pylorus, is preserved. Basically, this leaves a person with a stomach that's simply smaller. Removing 85% of the stomach creates a volume reduction significant enough to offer 55% excess body weight loss in patients who follow the appropriate diet plan. The removal of 85% of the stomach also assists in hunger, in that that is part of the stomach that signals hunger through a hormone called ghrelin. And so, with the absence of ghrelin and the restrictive part of the procedure creating an 85% gastrectomy, once again, the principles of restriction apply here. We see about a 55% excess body weight loss in patients who understand that the procedure is a restrictive procedure and does not affect volume. And therefore, patients would avoid liquids that have calories, would avoid drinking during, right before, and right after eating, and would eat foods that are proteinaceous and will empty slowly. Once again, it's only restrictive and will not affect the quality of food. You can drink milkshakes and eat chocolate all day long through this procedure, so it's important to understand that the principle only involves decreasing calories by way of volume. It is a good procedure with an excellent weight loss. Most patients do well. Once again, it is less effective in the super obese, diabetics, and sweet eaters. Not to say that it's not a procedure that would be a choice in those patients for other reasons, but typically we reserve this procedure for patients who are only interested in restrictive procedures, who don't have diabetes and are not super obese.